Um, let's first start with just the definition of what infertility is. Infertility is the inability of a couple to get pregnant after not using anything for birth control for a year. So it's normal for it to take a whole year to get pregnant. If women are over 35, we tend to start trying to treat that a little bit earlier than 1 year, usually at 6 months. Because when somebody gets to be 35 or older, then it gets harder and harder to have babies. About 15 to 20% of women will have infertility or what's called subfertility. Subfertility is where it takes you maybe 11 and a half months, the 12. It's like it takes a long time. Eventually you can get pregnant, but it can take a long time and a fair amount of intervention for patients to get pregnant. So out of that 15 to 20% of women that come into our clinic, that means that it's really 15 to 20% of the population that doesn't get pregnant. And 1/3 of that is because there's something wrong with how the woman ovulates or something like that. 1/3 of it is because of male factor. He doesn't have any sperm, or the sperm doesn't move, or it's not normal. 1/3 of it is because there's some interaction between the sperm and the egg that isn't good, or the sperm and the cervical mucus that isn't good, or there's something with both the man and the woman when they're trying to get pregnant. So what I do as a gynecologist is look at what are the reasons why women can't get pregnant. Do they not ovulate? Means, do they not make any eggs? Or are their tubes blocked? Or is the man not making any sperm? Or is there something about how the sperm and the cervical mucus and the eggs, they just aren't working together very well? Is the uterus normal? Maybe it's not normal. Maybe there's a lot of fibroids in there. So we look at all those things, and then we can do some treatment. And what the general gynecologists typically do is to give you some pills called Clomid. So a lot of you have heard of Clomid. But we can also send patients to the university and to other specialists to try to get more treatment, more intense treatment, all the way up to taking sperm from the man and eggs from the woman, and you put them together in the test tube. That's called in vitro fertilization. Then you put that egg back inside the woman. So all those things are possible. In the meantime, all of that, every time the woman gets her period, when she's trying to have a baby, that can make her really stressed out, make her disappointed, sad, make her not feel like she's worthy. And it can make the man feel the same way. Is there something wrong with him? Maybe that's going on in his mind. So that causes a lot of stress. And one of the beauties of this project that Fartun has started is to help women, especially, try to overcome some of the issues around not being able to conceive. But keep in mind, only 1/3 of it is just strictly due to women. 1/3 of it's due to men too. And another 1/3, it's the couple. So I think I'll stop at that for tonight, and we'll get to answer all kinds of questions later.